right, so I'm Amanda, and this is Laura, and
Hi,
we're
everyone.
gonna talk to you guys about specific diets and dietary research in IBD. So let's see. Okay, all right. So diet is an important part for better health, but there's no single diet suitable for all IBD patients. There are unique dietary recommendations that must be developed for each and every patient. Maintaining a healthy lifestyle, eating well, getting enough sleep, exercise, managing stress and exercise, which you guys just heard a bunch about, and all the anxieties, along with keeping bad habits at bay, will help minimize symptoms and help beneficial effects. So when you have IBD, leading a healthy lifestyle can help you manage these symptoms and keep you feeling well as preventing malnutrition, correcting nutrient deficiencies. Our ultimate goal is we want a diet that supports energy needs, provides all your vitamins and minerals, and doesn't worsen your GI symptoms. So we want to try to keep your diet as expanded as possible. So during a flare, this is the most common question of what to do. It's very individualized. Certain people will have worsening with triggers such as lactose, really fatty, greasy foods, certain spicy foods. We want to focus on getting protein at every meal. And then in terms of diet therapies for treating IBD, the only diet theory that with proven effectiveness is exclusive enteral nutrition for Crohn's disease, and it's still usually used following medication once someone's in remission or helping them transition. So I would like to mention that most of the research and usage of this is done in the pediatric population, and outside of like Japan, where they primarily use it, it's not routinely used as a first-line therapy for adults. The use of other, dietary therapies as a primary treatment for IBD is considered experimental and recommended to not be used in place of, but rather along with medical treatment. So a recent review study found that Crohn's and ulcerative colitis found that diet interventions are uncertain at this time, and firm conclusions could not be drawn due to limitations of availability of studies. So despite different claims on the internet and stuff, these are all very experimental, and these are all very kind of case-based. So they're more of an observational kind of trial versus an actual, like they did a study where they used a controlled versus implementing the diet. So there is a few, experimental diets that we are starting to kind of do some trials in and trying to explore more in. And one in particular is the Crohn's Disease Exclusion Diet. So it's a whole food diet that combines partial enteral nutrition with certain foods, and it is shown ability to reduce remission in mild to moderate Crohn's disease in a randomized controlled trial. So this one has actually been studied in a trial. And the thing with this is that individuals have to keep in mind that there are required, EGDs and biopsies with this if they choose to implement it. So the hypothesis behind this diet is it decreases the exposure to dietary components that are thought to negatively affect the microbiome, the intestinal barrier, and increase intestinal immunity. So the randomized clinical trial compared the tolerance and the efficiency of the Crohn's disease exclusion diet with a partial enteral nutrition compared to complete exclusive enteral nutrition. And after 6 weeks, about 75% of these participants, which keep in mind the study was on children, were found to were in steroid-free remission, and at 12 weeks, 75.6% were in remission. There are some limitations to this study as they didn't fully access the mucosal healing by an EGD within the 3-month mark. So another option is, thinking about those common symptoms that happen in IBD. The biggest thing we want to keep in mind that symptoms don't always reflect inflammation. So IBD and IBS can coexist. And so this is another option to kind of discuss with your dietitian or work with your healthcare providers to establish care to make sure if you are in clinical remission and still experiencing a lot of these symptoms, it is wonderful to, establish care with the dietitian, and they can work through the possibility of certain triggers, or there has been research that has found that the low Fodmap diet can be beneficial. So a systematic review established that about 35% of patients with IBD also might meet criteria for IBS. And so these persistent functional like GI symptoms, including the abdominal pain, the bloating, flatulence, diarrhea, can greatly impact your quality of life, and the low Fodmap diet may be beneficial. So what is the low Fodmap diet? It's an acronym that stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols, and they're all short-chain carbohydrates that rapidly go through the GI tract, and then when they get to your large intestines, they rapidly ferment by these short-chain fatty acids, and they can produce gas. They can give an osmotic effect, which means water is drawn into the GI tract quickly, and can cause that urgency or the need to run to the restroom, and that a cumulative increase of these can cause a lot of symptoms. So that's where you will hear us commonly talk about like the bucket concept, where if you're filling up your bucket too much with these high Fodmaps, it's causing you to spill over and be symptomatic. So the thing with the low Fodmap, and I like to stress this a lot, especially with the IBD population, because sometimes you're struggling with being underweight or maintaining your weight. It's definitely not a forever diet. It's usually done in 3 phases. You got the elimination, the challenge, and the customization or personalization phase. And kind of the goal with all of this is to improve your GI symptoms, identify triggers, trying to meet all your micronutrients, so meeting your vitamin and mineral needs while reducing your symptoms. So Laura and I kind of went through this together. She came to me, and at first when she came to me, she had met with another dietitian, which she'll go into, and I just kind of will do a little back and forth now with Laura. So what were your thoughts before meeting with me, and how did you establish care? And then tell me about like your thoughts of how food actually relates to your symptoms before we met.
Yeah, before I came in to see a dietitian, when it was recommended, I just didn't think I needed a dietitian. I've been eating my entire life. I can figure this out on my own. And what spawned the discussion to finally bring it up was I was in a U of M study and they were tracking my symptoms and they recommended me seeing a dietitian. I was hesitant about going. It took me a while. I did see a dietitian and got things going, and then I tried it on my own and came back and got some refining help from you, Amanda. But it was sort of like if you hear of anyone going into a recovery type program where they say, I don't belong here, I can do this on my own, I don't need someone to help me do this, I can figure it out on myself. That's how I felt when I first started going, and that proved all wrong, just like most programs like that thought processes do, that I did need the help. And so the items, do you think the food affected your GI symptoms? I knew they did, but I didn't know to what extent, and I didn't know why they were impacting me. So what ended up happening is I would take items out of my diet on my own, and then it ended up where I had a very, very bland diet, and quite frankly, it was very depressing. I was confused because I could eat something one day and not eat it the next day. And I was really struggling with it, and I was really frustrated with my choices. And there was a point at the beginning where I would walk into the grocery store and I got what I call grocery store paralysis, where I just looked in this huge store and says, I don't know what I can eat today. I don't know what's going to bother me. And I don't know what to do anymore. So that's what really drove me to go to see the dietitian.
All right, good. So after, we met and we talked about the low FODMAP, and I know you implemented it, how quickly did you see your symptoms, improve?
Yeah, I saw pretty quickly, actually, the first phase of the elimination. And when within probably about 4 or 5 days, the pain really was subsiding, and I could really, that's really when the pain started getting less and less. I said, wow, this is amazing. And actually what happened is it was giving me hope that there's something out there that can help me when I'm in pain 24/7 and I don't want to eat, but I need to eat. And knowing that I eliminated the foods, the first step, I was getting some relief that encouraged me to continue on to explore how to do this and do it the right way.
Yeah, good. Did you find it was hard to, implement the recommendations?
Not really hard per se. There's a lot of things that you can eat, and there's a lot of things that you can't eat, and then there's a lot of things that you can eat in moderation. So it's the balls and juggling them and figuring out what works for you. What bothers me may not bother somebody else. I may be able to eat, a half an apple once a week, or someone can eat an apple once a week, so it all, gets back to your, the third phase of personalization. And once I got through the elimination and started bringing foods back into my diet, finding which ones bother me, and then I could adapt what was going on with me personally. What it did was it broadened my scope, actually, because when I was doing it on my own, it was such a bland diet. I was able to actually broaden my scope because it told me what I could, different things to try. So I started trying different spices in my food, and that actually encouraged me because food was actually tasting better other than just a scrambled egg every other day. One of the items, garlic and onion, are two of the big culprits, and I took those out of my diet. But when I went to go see you, you introduced garlic infused olive oil, and I never would have gotten that in just researching it on my own. So I was able to bring some more flavor back into my diet by seeing you. So it was really neat, to explore the different things and start broadening my diet. But one of the questions that I had when I came to you, why do some foods bother me today, but they don't bother me tomorrow? What's going on with that?
Yeah, that's a great question. I think that's one of the most common questions people have, is wondering, it seems to not matter what I eat. I can eat the same thing every day and not bother me sometimes and bothers me others. So that's where I keep referring back to the bucket concept, but I really think that is key, is thinking of not overfilling our bucket, and these different high FODMAPs as well as different non-food related things can fill up your bucket. So, environmental factors, stress can fill up your bucket. So if you know that things like garlic really bother you, we try to pull back on it and not consume it in large quantities. But if you know you're going to your favorite restaurant and you want to have it, then that's when you really want to make your bucket as low as possible so you can enjoy that without overflowing and filling up your bucket too much. So I know you had told me of a great story recently where this kind of concept came into play. If you want to share that story.
Sure. a couple weeks ago, you know, we're in Southeast Michigan, cider mills are opening up, and gluten and is something that's on the list, high Fodmap, and apples too, actually. And but I really wanted to participate in it. So what I did is I made sure that in the morning everyone was eating pancakes, and I chose not to. So my bucket wouldn't fill up. And when I was able to go to the cider mill, that I was able to have a little bit of cider, and I was able to enjoy a donut there. So I was able to participate with my family, but still, and not cause any more undue pain or stress in my system. So but following the FODMAP and knowing what my triggers are, where I can eat small portions of those two things, that I was able to successfully enjoy an outing with my family. And that, to me, it makes all the difference. Yeah. There was another instance where I'm a big Coke fan before I got sick. Sorry, Pepsi people, but I drank a lot of Coke, and I knew I was going to really miss it. And that's one thing about the FODMAP diet, is that you don't have to restrict everything that you enjoy. And dietitians were able to help me find that you know, high fructose corn syrup and carbonation are really bad for us. So they told me about Mexican Coke, and there are other options today than there were back when I was doing this, and that's made with cane sugar instead of high fructose corn syrup. So now I take a Coke and I pour it in a glass and get rid of some of the carbonation, and I'm actually able to enjoy something that I used to enjoy. So it's not literally a diet where it's taking everything out, but it's teaching me where I can enjoy the things that I like in a proportion size that doesn't cause me any more harm. So that's a big win for me.
Yeah, portions are a big thing, and you mentioned a few times like enjoying things with your family and quality of life. Like that is the part we want to expand the diet as best as we can. So it's not implementing quality, like ruining, you know, quality of life. And so there aren't yes and no foods. It's just finding your like threshold. So, you know, tell me how I was able to tailor it after you've completed the challenge phase, and how you were able to, you know, feel like you were able to expand your diet.
Yeah, you're able to help me adapt what I'm doing, what I'm eating, to fit into take the diet and adapt it to my lifestyle. So what ended up happening is that my diet's more diverse than it ever has been in years. I cook with more variety, use different spices. That was a big thing. A bland diet is that, bland. And so I was able to explore different spices that work for me. I'm cooking more, so I can control the ingredients that are going into my foods. But because I'm doing that, I'm able to go out once in a while with my family or my friends and enjoy a meal and know what things to look for in a menu item that will be a trigger, and I try to avoid it. So there's, you know, it just, you've been able to help me adapt what I'm doing, so I can have a better quality of life.
And that's great. I think most of us don't realize how important eating is as part of our, just socially, until you start having real trouble with diet. I have a question from Marina Gendek asking, what are some examples of proteins to eat if you want to gain weight safely without getting a flare?
Oh, that's a great question. So I know I usually recommend things like eggs or low-fat meats are good. You know, beans and lentils in small amounts are normally really well tolerated by individuals. You know, dairy, if you have trouble with lactose, so lactose-free dairy products, you know, trying to get an array of different foods.
Okay. We often recommend proteins, especially to folks who've lost a lot of weight after a flare or after surgery, to help them heal their surgical wound. What's a reasonable number of protein percent, or for somebody who's trying to heal and gain back weight, what should they be looking for as a target for protein intake?
So that depends on the individual, but we try to aim for about 20% of their total calorie needs. So, you know, I can't say like a strict 60 to 80 calories or 60 to 70 calories, but you want at least 20 to 30% of your total calories to be coming from protein.
Yeah, and I'll tend to recommend people go to the high end of that when they're healing from surgery or have an abdominal wound or fistulas or something like that, where they're rebuilding structures. That's really
important. You could also use 1.5 grams per kilogram if you wanted to calculate your own after surgery.
Okay. I also have a couple other questions. Is it true people with IBD should try to avoid adding extra fiber to their diet?
So that is very, I think that has kind of been studied and proven that fiber is okay. Fiber can be problematic if you have strictures, and that is more the type of fiber, you know, certain types of insoluble versus soluble. But fiber in general is really good for the GI tract, and it actually helps it heal. And we want to gradually, if you were on a low fiber diet, we want to work to increase your fiber very slowly, because it can cause some bloating, and then people think, oh, it's causing inflammation, but that's not always the case. It's probably just a little irritation. So we want to do it in a slow way and increase your fiber intake.
Okay. Another question from Vinod Atmakur. How bad is gluten for Crohn's disease? And then Laura, if you can talk about your experience with gluten, kind of get your perspective as well.
Yeah, gluten for me, I found that I can tolerate it in small portions. When I first started reintroducing it, I had a half of a muffin, English muffin, and I said, great, I can have it. I did it. By the third day, I was doubled over in pain. So I realized that I can have it. I can have it in smaller portions. I'm also finding out sourdough bread, which has been the big rave during the last 6 months. I started making my own, and I seem to tolerate that a lot better. So for me, it's experimenting and finding my limit. And again, I make sure I don't fill my bucket. If I know that I'm going to go somewhere where there's going to be items, I just make sure I load up on protein before I go.
Okay. Another one on how does alcohol affect IBD?
So alcohol is, can be pro-inflammatory, and it can cause some dysbiosis to the gut microbiome. So we try to limit, alcohol intake. It's not no alcohol, but I always encourage to be responsible and try to decrease it as best as possible.
Don't act like a freshman on a football weekend at the University of Michigan.
Exactly.
We do know that, and this is from rodent experiments that we do in the lab, that doing alcohol enemas actually causes ulcerations in the colon. You can give a rodent a temporary colitis that way very easily. Unfortunately, about 10 years ago, it was very trendy during fraternity hazing to do alcohol enemas, and we started seeing a wave of alcoholic colitis in freshmen who are undergoing hazing. It was a bad fall for us at the University of Michigan. So it is really, temperance and moderation are really, really important. But everyone has slightly different sensitivities, but generally small amounts are usually okay. Large amounts can definitely get you in trouble, for sure. Another question on, are there any data or studies on keto, paleo, or other trendy diets have any particular effect on IBD?
No, so there's no studies out right now, and I really, especially for IBD patients, try to veer people away from them because they're very restrictive, and that can cause more food fear and can cut calories, micronutrients, so your vitamins and minerals that are really important. That can really decrease with these different trendy diets. So there's no research at this time, and also some of them can be really high in things that can be actually like triggering, the fatty, greasy foods, or a lot of spicy foods. So
great. Well, I want to thank you and thank Laura for your time and sharing this experience.